Thanks, everybody. I will not be playing the piano, but it is my great honor to be the opening act for John Legend. So just 5 minutes, and you'll have good music, so bear with me. So Dickson is kind of my hero in many ways. He's the first programmer in Africa I was smart enough to hire. He was actually trained by Nathan Eagle, who will be speaking later today. And he's the reason why our ChildCount project in Kenya is working. And he helped me realize a really important thing. And this is the one thing I want you to take away from me today. And that's Africa is ready to code. Okay? We have great human potential. I'm glad some people laughed, because I think the Mountain Dew is funny. Great human potential, great ingenuity. We have fiber. We're no longer sipping through a straw. And I took that picture of the Mountain Dew the day I hired Dickson. I think that's like serendipity if you've ever seen it before. So about a year ago, actually with the gracious support of Microsoft, we set up the World Technology Lab in Mali. And we're training the first generation of programmers there. It's a country where there's not one formal programming class at the national universities. So using volunteers, I worked for the Geek Corps before. We started off with programmers who didn't know HTML, and they left knowing Scrum, Agile techniques in Python, Django, and RapidSMS. RapidSMS is an open source platform, and it's really aimed at using ubiquitous mobile phones. And we've been focusing our initial work in health. So this chart basically shows you the leading causes of child and maternal mortality. And here's access to mobile phones in Africa. More people have access to a mobile phone now than fever treatment, diarrhea treatment. So for me, that shows a lot of potential. It's exciting. So this is me. I think it's the only existing photo of me with hair. And I was born in a small village in northern Cameroon. And working in Africa, growing up in Africa, I've always kind of wondered, why was I afforded certain privileges, namely a healthy childhood? And it's really because of the color of my skin and who my parents were, and that's always kind of bugged me a little bit, or made me kind of wonder. So with my colleagues at Columbia University, the Millennium Villages Project, we created an open source platform called ChildCount. And the real goal of ChildCount is that every child and mother counts. If you're born at home in a rural village, you're not born in a health facility, and say you die from pneumonia in your first 7 days, other than your family, there's a real chance that nobody ever knew who you were, okay? If you make it past your early childhood and you're not registered into formal health systems, it's really hard for us to make sure you get access to healthcare services. You might not have a birth certificate. In many countries now, if you don't have a birth certificate, you can't go to school. So what we do is we work with community healthcare workers. These are the front lines of health. They need to be paid. You're going to have a wonderful presentation from one of my fellows later, Raj, who's changing this approach. And with a basic SMS message, they send in the information of the child's, their name, their age, and they get back an ID number. They're in a system. They've been counted. And with that, we can track their health. So we don't collect this information and send it off to a Ministry of Health. We collect this information and give it back to the communities in a patient registry. So every month, the community healthcare worker gets all this information, and they use it to systematically ensure the health of their children. In our first site in Kenya, in 3 months, we were able to register 9,500 children, which is about 95% of the kids in the community. We have now over 10,000 kids, 5,000 mothers. We have 5,000 kids in a site in Uganda, 5,000 kids in a site in Ghana. So this approach works. Once you have it, you can do some really cool things. In 1 week measles campaign, we were able to register 94% of all children in the community. As one of the healthcare workers said, this is wonderful. We no longer have to chase chickens. Okay? We just find their ID, we text it in. We make it systematic. Allows us to really make sure, in terms of nutrition screening, that everybody in the community has access to the healthcare, not just the people closer to the clinics. We've collected over 30,000 MUECs in the last year, so 3 nutrition screenings per year in the first year. It helps us do malaria management. And if we know about it when a mother's due date is, we can make sure she gets in for her antenatal visits, and and we can try and make sure she comes into a clinic for a safe delivery. So ChildCount, really the strategy behind this is ChildCount will be supported by Rural Technology Lab, and it'll be them that come up with the next big idea, not me. Alu, who's one of our programmers, for me is really, he holds the future of Africa in his hands. And just as I end, I would like to just take a little bit of your time and introduce my fellows, my first programming class of programmers at the Rural Technology Lab. So this is Alu. And what I'd like, technology is fundamentally going to change the way we do rural healthcare, we do rural agriculture. But please don't just focus on the outputs. I'd ask you also to invest in the inputs, which are these people. It's just like food. You want it local for it to be sustainable, right? So please help me help them be the solution. Thank you very much.